Aloha. All right. Glad to see everybody. It's no secret, I think, to most of the people in this room that have been concerned with the issues involved here for some time that one of the duties I had as a probation officer many years ago involved some of the first instances in which there was testing for drugs, and I had some responsibilities in that area that first made me very much aware of the conditions and circumstances surrounding whether abuse of drugs, marijuana or otherwise, should be considered in terms of criminal procedures or health procedures or both. And in some instances, obviously, where there is abuse, whether it's with drugs or with anything else, you might have a criminal connotation associated with it, and the criminal justice system should come into play. And in other instances, there is a definite public health issue involved or individual health circumstances. A quick example being, at that time and continuing to today, palliative care with regard to extreme pain. This is becoming more of an issue as our society ages, as the incidence of cancer and rheumatoid arthritis, all kinds of diseases and conditions that tend to be associated with an aging society come into play as well. We don't want to set criminals, we do not want to allow, rather, criminals to set the standards by which medical procedures, let alone medical personnel, are going to be directed. I recall at one point concerns about the utilization of, say, heroin or morphine in conditions at the end of life of extreme pain, and the possible utilization of these Schedule I drugs, the most dangerous drugs, the ones that have the most criminal penalties associated with them, the steepest criminal penalties associated with them, that you couldn't have a hospital have, say, heroin or morphine in great quantities or in large quantities, even whether it was gerontological or geriatric patients involved, because it might be stolen, or it might become the object of a robbery or a burglary. And I thought to myself and think today, in other words, someone else's pain is going to be addressed on the basis that somebody else might commit a criminal act. That is not what's, I think, a society that has a sense of compassion and a society which values freedom is a course that they want to pursue. And what the legislature has done in this instance is not address any questions about whether or not, in this instance, marijuana, as opposed to some of the other examples that I've given. Not addressed whether or not marijuana is to be sanctioned or not sanctioned, whether this is an issue of morality or immorality, whether this is even an issue of whether it's to be accepted or not accepted. The point here is, and this has been addressed essentially, especially by those in the legislature who have jurisdiction and responsibility for health issues, is to address very firmly the condition that I have outlined in my opening remarks. If there is a medical condition that needs addressing, then they wanted to write legislation that would put responsible people on a responsible course that they could rely upon in terms of their liability, both civil and criminal. In this instance, the healthcare system and healthcare providers, to give a legislative outline, that is to say, a legal framework within which they could make their medical judgments. Secondly, we wanted to establish once and for all that to place the jurisdiction in terms of decision-making with regard to marijuana, or for that matter, by extension, anything else that involves drugs. It's solely in a criminal justice context, particularly in the Department of Public Safety, which after all comes in after the fact. One of the reasons I began my remarks with my experience as a probation officer is that we were coming in after. The probation department came into the criminal justice system, came into effect. Judges asked for sentence reports or even pre-sentence reports on the basis of an arrest and often a conviction. So that involved the criminal justice system almost exclusively, to the exclusion of circumstances that these bills that address, which is to say, how can medical personnel, responsible medical personnel, address the question of the utilization of marijuana in a context of public health, as opposed to exclusively residing within the area of public safety or criminal justice. I think that both of these bills have handled precisely those questions and those observations in that context in a responsible and thoughtful way. These bills are carefully drawn. They've been thoroughly vetted in terms of the public, the availability of public commentary. And what they've done is I think, separate opinion, which anybody can have. And I remember Jack Burns at one time, Governor Burns, said at one time, any fool can have an opinion, and most of them do. It's not a question of opinion. It's a question of putting the facts in a context that makes legislative sense on behalf of the community as a whole. And I think that the folks who are here today representing the legislature as a whole have done precisely that. I think it's an excellent example of not letting emotion or fashion and opinion of the moment prevail, but rather to take a look at context and the public good that we're obligated to put forward, and then acting accordingly in a legislative context. So, Bill HB668 makes marijuana a health issue versus a public safety issue, if I can summarize it. It doesn't diminish in any respect the rule of law. On the contrary, I think it clarifies it and gives a direction and substance, so that the hard work of protecting our community is not impaired or undermined in any way. And the SB642, in my judgment, facilitates responsible medical use of the drug properties associated with marijuana. Most particularly, I think it addresses the question, which otherwise has to be dealt with in a criminal context, or could be dealt with in a criminal context. That is to say, whether or not people take advantage and mask marijuana use in the guise of facilitating treatment for pain or other medical conditions for which the utilization of marijuana or certain qualities, certain components in marijuana for medical purposes. If there is anything, I think, which describes that situation legislatively in terms of this of the bill 642, it sets in motion what should be the principal focus. That is to say, a decision by competent medical physicians and medical personnel, a decision as to what they think is the best course of action with regard to the use of any measure to relieve pain or to advance a healing context. So, I want to make it clear that in my judgment and the Attorney General's judgment, there is no violation of federal law in any respect, nor is it intended to undermine in any respect existing federal law or other laws currently on the books where a criminal justice orientation is in fact warranted. So that was an awful lot of activity that had to be, explanation that had to be put forward, but I want it on the record that these are contentious issues, easily sensationalized, easily subject to obfuscation and ideology, or even philosophical orientations that don't necessarily have anything to do with the subject matter of the legislation itself. And it takes legislators who are clear-sighted, have a clear vision of what it is that's at stake, and are not allowing themselves to be subject to hysteria or to the admonitions of those who have an agenda of their own, which doesn't necessarily advance the issues involved here, namely health and public health and responsible medical use of marijuana. So, with that, I'm going to ask if it's, I think I've got everybody here, Senator Sparrow and Senator Green, Representative Bellotti, I think, are the principal legislators that are here. If they would want to come up for this signing, representing both the House and the Senate. And I want to recognize, obviously, there's many people in the room who have an interest in this legislation, some of whom who have followed it for many years, not just a couple of legislative sessions, but for a long, long time. And we'll certainly want to give you an opportunity to immortalize this situation through photographs when we get through. But for the signing right now, I think I want to concentrate on the legislative side of it. Any of you care to make a comment or two, or have I bludgeoned everybody into submission with this exposition?
I will.
Okay, Josh.
Thank you, Governor, for signing these measures. And I was just really grateful that we were able to work in focus to make this a mainstream medical question, where we will be able to work with the Department of Health to make rules to make sure that no patients ever are denied access to medical marijuana if they need them, but to really look at the system in that public health context. So to have that focus, Governor, it was terrific of you, and that's really what we set out to do. Like you said, a lot of people feel very passionately, and I respect that, about the issue, but the truth is that for years, physicians have been concerned about making this a part of the mainstream medical question because of the ramifications of being vilified as a doc, and I can say as a physician that goes on. So many physicians wouldn't find their way to giving a certificate to patients. We are moving the system away from that problem to make it a mainstream health question. And I have no doubt that the Department of Health will run this program elegantly, so we thank you for signing the measures.
Yes, go ahead, Bill.
I just wanted to thank the community advocates, everyone who worked on this long before I became the health chair. So it was really gratifying to be able to work with people in public safety, in the Department of Health, and in the community. I think this is a reflection of the good work that we all do when we work together as a community.
Yes, I think, well, you want to say a word or two? Okay. I want to make sure everybody understands that these two comments, I think, serve to bracket what I was saying. This gives an opportunity for healthcare professionals to be able to zero in on procedures that will stop abuse. This is going to be a big step forward in stopping people from gaming the system, which has as its legislative focus the relief of pain and the treatment and the utilization of the properties of this particular drug in a medical context. These two bills, I think, will advance that cause, and to the degree and extent that succeeds, to that same degree and extent, will have moved patient care forward. I'm going to get my chair. Here it is, right there. Thank you. Both of these bills are entitled Relating to Health, appropriately enough. And so the first will be 668. Done. And the second, 642. Done. There we go. Well, shall we take a couple of pictures to immortalize, and then we'll ask everybody who cares to come up either in groups or by section, however you've delineated yourself, you've categorized yourself, and we'll take some pictures, those, with the legislature.